The Global Drug Survey is an annual report on the prevalence of drug use around the world. South Africa participated in the survey last year for the first time. The recently published results show that even with COVID-19 and the related lockdown restrictions, drinking alcohol remains the world's favorite activity. According to the survey, some of the biggest drinkers in the world are English and Scottish. Interestingly, more than a third of respondents regretted getting drunk. Let's help you better contextualize this. Bring in Dr. Keith Scott, who's co-founder and chair of the South African Drug Policy Initiative. Doc, thanks very much for your time and welcome to the AM Report. Perhaps we can start by placing this research. What questions were you asking and what were you hoping to get out of those questions?
Yeah, thanks very much. Well, the global drug report has been going for several years, and the aim of it was started by a professor of psychiatry in the UK, and he runs it. And the idea was to find out more about the habits and how people took drugs in general, including alcohol and other drugs and illegal drugs. And the aim of it is to help policymakers to reduce the harms of drugs, actually, not to stop people using, but just to reduce the harms. And of course, alcohol is the one with the greatest harms and the greatest side effects, etc. And, last year was the first time they included South Africa in the survey. So we have got some data on South Africa. And now, obviously, the results from the 2020 survey have come out, and we're going to start the new survey this year. So we're trying to recruit people to get onto the website and give their input. It's a anonymous one, so you won't be tracked down if you take illegal drugs. Yes, so the alcohol results are very interesting. And of course, as you mentioned, people had regrets about drinking too much. And that's an interesting thing because it means that people don't want to actually drink that much, but they can't help themselves. And the reasons that they can't help themselves are several. If you wanted me to, give you an example of.
Absolutely. I mean, in fact, that was the question I was going to ask. Yeah, please go ahead.
Complaint was a bad hangover, which we all know about. And the second worst one was that people said something they shouldn't. So they let the cat out of the bag. The other one was increased anxiety the next day after drinking. And that's an important side effect because alcohol is a downer. It suppresses the central nervous system. And then you get a rebound effect the next day. And people feel very anxious and they might take drugs to relieve the anxiety. And that drug might be alcohol and so on and so on. The next day is the same thing. The other one was they ended up in arguments or fights. The other regret was they failed to do something that they should have done, something important. And the other one was that they had sex with someone that they realized they shouldn't have actually had sex with, and probably without protection. So, and then injured myself, and there were some other minor ones. But those are the major ones we can learn from. And then, of course, there's the context of why they drank so much. If we can talk about that as well.
That's exactly where I was hoping we can go. If the regrets are so widespread, how and why are people finding themselves in those situations to begin with?
Yeah, well, thank you. That's the other thing that was interesting about the results was that the survey had asked the questions, and these were the answers they got, the main ones. Why did they drink too much? And the main reason most people drank too much was they drank too quickly. And they'd often start drinking before they went out to a situation where they were going to drink. So drinking too quickly was a big one. The other one was the people mixing drinks. And the reason mixing drinks is a problem is because you can't judge the amount of alcohol going in if you mix, say, beer or wine and then you just start drinking shots, because the concentration of alcohol is so different. And you probably take too much more than you thought you should. And the other interesting is peer pressure. If you were with the people who drink a lot, they're going to pressure you to drink more with them. So don't drink with people who drink a lot more than you want to, unless you've got a good willpower. And taking other drugs at the same time. Mixing drugs is a big, big no-no in any situation. Don't mix your drugs. And people regretted that. And that was one of the reasons. And then also drinking to drown your sorrows is not a good idea. That makes you drink too much. Drinking when you're in a bad mood or you're sad. So those are the important ones.
Yeah, and there have been a lot of calls for us to start speaking about the psychological signals we're getting from how much South Africans drink, essentially. You know, even the issue of the ban being such a contentious issue really raised eyebrows about whether or not we're having the conversations we should be having about the drinking culture in this country. That's the term I'm looking for. Is this study able to provide insight about ways through which you should be handling that societal issue?
It's not really looking at that specifically, because that's quite a difficult thing to put on a questionnaire. And the main thing at the moment, obviously it's important to find out why people are drinking a lot. And so that does come up to a certain extent. And but obviously, I think we're aware of it. If people who drink too much or take too many of other drugs generally have psychosocial issues. So we have to look at and especially in South Africa, the social issues are very important, and often people live in dire circumstances where the only pleasure, in fact, is taking a drug of some sort, whether it be alcohol or cannabis or an illegal drug.
And from the findings of this research, Doc, are we able to ascertain whether something like a ban is good or bad in the long term? You know, many people are arguing, for instance, that if you prohibit people from being able to buy these things freely, they turn to the illicit market, and there's all kinds of ramifications for that. But outside of that, you also get the sense that once people finally get the opportunity to again buy these things legally, there's an opportunity to binge because they've been deprived for the period in which the ban has been in place. Speak to us about that, if at all you can, through this research.
Yes, well, you've covered most of the important points there, and the 2021 Global Drug Survey is actually asking those questions. It's directed at people's consumption of alcohol mainly, and other drugs during lockdown, because it's a unique situation, and it's an opportunity to find out the answers to all those questions. We do have some indication in terms of what happened during lockdown. You know, I'm the chair of the South African Drug Policy Initiative, and we criticized the ban of sale of alcohol and tobacco right from the beginning. And we pointed out why it was a problem. And in fact, what we warned came to be that the people who could afford to stocked up, the people who couldn't went down to buy a drink, and they got shambucked and arrested. So it was basically a discriminatory order. And then also there was binging. But apart from that, obviously we want to know if lockdown was stressful and people drank too much. Did it increase domestic violence? Did it decrease it? So those questions we'll have to come back at the end of the year and give you the answers.
Right. I didn't intend to hop on this issue, but you know, given that, does it make sense for South Africa's lockdown regulations to include something like an alcohol ban, considering what we now know to be the potential side effects?
Well, there's one argument that is put forward, and there is some validity to that, in that it reduces the burden on the emergency services because of violence and traffic accidents, etc. But there is the other side, and that's the one I've alluded to earlier. It's a discriminatory law, because people who've got the space and the means to stock up with vast amounts of alcohol can do so, and that's the wealthier population. Yet people living in crowded townships who can't even distance, let alone do all the other things that we required to with COVID, they don't have any alcohol at all. So in my view, there's a middle ground, and we can learn from this. People are already making noises about changing the alcohol laws in relation to this, the laws in the pandemic. Some of them are a bit more extreme than others, but obviously they need to be done, and it's going to be an interesting exercise to see what happens.
Absolutely. Well, the Global Drug Survey looked at, you know, trends in other countries as well, finding that the English and the Scottish are among the heaviest drinkers, so to speak. How do we compare with our counterparts in other places of the world where you surveyed these trends and motives for drinking?
Well, the short answer is we can't, because the survey that we joined South Africa last year, we only got 500 respondents, and they came from sort of middle upper class backgrounds who had access to the internet. So it's not a representative cross section of South Africa. Having said that, that survey sort of fitted in quite well with the European results, but it certainly doesn't reflect the rest of South Africa. And we just have to get more people signing on and filling in the questionnaire before we can give that answer.
It's incredibly interesting, because of course we also know that consumption trends and motives could be class dependent, right? People drink for different reasons in different classes. How are you then planning to have a more holistic outlook, for lack of a better term, here in South Africa? How are you going to reach out to people who couldn't participate for whatever reason in this round of the survey?
Well, the main way we're doing it is through media such as yourselves, and thanks very much for giving us the opportunity. So if people can hear us talking about the global survey, then they can go on to the 2021 one and fill in the form, which takes about 20 minutes, and that's globaldrugsurvey.com. It's fairly straightforward. So it's through the media and press releases that we get more people on board.
Well, thanks for your time. Really interesting findings, and hopefully we'll be able to extrapolate and help them make sense even for the policymakers of our country. Appreciate your coming onto the program. Dr. Keith Scott is the chair of the South African Drug Policy Initiative. Appreciate your time indeed.